So, good morning, everyone. Welcome to our Congress. I will show you my presentation right now so we can start. My screen sharing is disabled. Meanwhile, while it's going to be updated for me, I want to thank you all for the invitation to be here and welcome all the participants to this beautiful Congress, and I'm sure that you will enjoy a lot. So the idea here is to talk a little bit about the fear. So fear of falling or falling from fear. So that's a very important thing that we need to be aware of when we are dealing with patients that are at risk of falling. So we need to break this vicious cycle. Okay, so let's start with the definition of fall. So according to the Cambridge English Dictionary, it's to fall, it's the suddenly go down onto the ground or towards the ground without intending to or by accident. And let's see a little bit of the demographics of falling. So 30% of people aged over 65 years and 50% of those older than 80 years experience at least one fall every year. And that's very interesting because I'm 44 actually, and I experience like 4 falls every year. Can you believe that? I live in Canada and there's a lot of ice around here. So it's normal, I like to walk. And then I go to the streets when there's some ice because I need to walk even when it's really cold. And it's normal to sleep in the ice. And sometimes it happens. Sometimes the streets are not clean as they should be. And it's possible to experience some falls. So exactly as we talked in the beginning of the presentation, there is no age to have the risk of fall, actually. But obviously, when we are older, we have more problems. And it's interesting because of this population that you see here. 1/3 of them are repeated fallers. So that's when the danger it's increasing, right? So a little bit more of demographics here. So in 2014, and still is a common concern. 1 in 4 people, adults, reported a fall. So it's a lot, right? More than 7 million of those falls required medical treatment or restricted activity for at least a day. And 27,000, more than 27,000 older adults died as a result of falls. So it's a very important issue for us to talk today, right? And what is the fear of falling? That it's very different from the risk of falling. So fear of falling refers to persistent, fearful anticipation of falls. So the persistent word here is very important because when you have a fear of falling once in a while, there's no problem, but the persistent fear, that's when the problem begins. So let's give another definition of fear of falling so we can discuss this a little better too. So the fear of falling, we can define it as a measurement also. And it's interesting because this definition also helps us to measure the fear of falling clinically if you want. It's a very simple thing that we can use at our clinics. So to measure the fearful anticipation of future falls by using one item question, it's very interesting. So what do you ask your patients? At the present time, are you very fearful, somewhat fearful, or not fearful at all that you may fall? So this will give you a hint about what your patient feel about that. And you know, I don't know you, but I have fear of heights, for example. So this image for me, if I am the person that it's almost hanging on this building, right? I will have a lot of fear. So from time to time, it's normal. But while I'm walking, even when there is there's no problem at all. But when there's some ice on the streets, well, I have no fear at all. So do I have a fear of falling? No, according to this definition, no, because or the past definition, because it's not persistent. And a little bit of demographics of fear of falling now. So it's not the risk of falling, but now the fear of falling. So among other people, again, without a false history, we have 1 in 3 older people without a false history, right? And with a false history, obviously, it's easily to get scared about the falls, right? So we have 2 in 3. And then some of them, 1 in 2 without a false history and 2 in 3 with a false history, they report some fear of falling. And let's discuss a little bit, is fear good? Yes, it is actually. Because fear, it's made to protect you. As I told you before, I have a little bit of fear of fear of heights, and which it's not. It didn't stop me, for example, to do bungee jump, for example. But I will never stand as this person in this rock, for example. Is it good for me? Well, I think it is. I have no problem. That's not an experience that I'm missing in my life. And it kind of protects me in some way. It protects me from potentially dangerous situation. So a little bit of fear is good. A little bit makes you look at both sides of the street before crossing, and that's very important. However, a fear that paralyzes you or hinders your ability to do normal movements, that can be dangerous. And that's exactly what we are talking here today. So who has fear of falling? And it's important because we talk about the demographics, but this is a different perspective on the demographics, because the patient certainly has the fear of falling, right? Who else has this fear of falling? So that's very curious, because we actually have the fear of falling of the patient when we are physical therapists, when we are healthcare providers, and even clinic owners. You don't want your patient to fall. You really don't want to fall. So that's really important. So the safety, it's not only for a patient, but it's for you. So we have to have this in mind. We need to have this in mind. And what is the health impact of the fear of falling? Well, it's more than we may think. It's an independent risk factor for reduced quality of life, activity restriction, loss of independence, and fall risk. So fall risk, as we talk, it's a leading cause of injury, morbidity, and mortality. Well, but fear should make you safer, but not in this case. A lot of fear will increase the fall risk. So we have to address the fear of falling as well. So it's not just the fall risk of the patient, but the fear of falling as well. So we have 2 problems in one usually. Well, to talk a little further about this, I need to remind you about how the balance work, and it will be really fast. So usually we have, normally, actually all the time, we have the center of gravity and the base of support working together. So what's going on? It's to have a good balance. I need that the center of gravity falls in the middle of the base of support. So that's really important. Sometimes I need the green space that you see in this picture is the base of support. Sometimes I need a wider base to have a better balance. For example, this position, the second position you can see here, it's like a fighting position, for example. So a wider base will make it harder for the opponent to throw me on the floor. The third image here, you see it's a person using crutches, and the crutches actually it's widening the base so you can have a better equilibrium as well. So to make, in order for our center of gravity to stay in the middle of our base of support, we have some balance strategies, because from time to time, that's normal. The center of gravity goes out of the base of support. So when this happens, we have three strategies to make us avoid falling. So the first one is the ankle strategy. The second one is the hip strategy. It's a bigger strategy. And the third one, and it's the biggest of all, is the stepping strategy. When the two other fail, then we have to step to not fall. So this is our three strategies. And this is very important for us to discuss why we have associations between fear of falling and reduced balance performance, and why this is a vicious cycle that we have to break. Okay, so every time that I have this, just for you to know, every time that I have for example, here I have how fear of falling can increase fall risk in older adults. This is the article that I looked for, giving you this information. I'm talking all the time about it, but it's here for you to know, right? And if you want to have this information, where I got them, it's here. And usually the majority of them, it's from new systematic reviews. Systematic reviews are in the top of the scientific evidence, so it's very important. Falls has a lot of scientific reviews in that sense, so it's very important for us to be aware of that. Okay, so stiffening strategy, and this comes from this article here. So the stiffening strategy came as a strategy for dealing with the balance when we have anxiety or fear. So how do we control? You do a better postural control. Is not better, actually. So what we have when we have this stiffening strategy, we have a reduced range of motion of the center of gravity by reflexively co-contracting tibialis anterior, soleus, and gastrocnemius muscles, resulting in lower amplitude and higher frequency of postural sway. Just to remind you also, the postural sway is like what you're seeing in this picture. So it's normal. We all have, I'm standing right now and I have this sway right now. So we have this sway, laterally, and anterior posteriorly. So it works in all directions, actually. And every one of us has this. And to adjust the postural control, we are always contracting some muscles. And science has seen many times, and it's normal, it's very well known in science, that when we are anxious or fearful, we have this stiffening strategy, which means our range of motion is reduced of this postural sway, but the frequency it's augmented. Okay, and that's it's a paper of mine, and it's interesting because I've studied a lot of posture, and actually what I have seen in posture, studying the relationship between emotions and posture, it's more or less the same thing. So there is a relationship between fear and protrusion of the shoulders, which that's not exactly what we are talking here, but increased tibiotarsal angle over 90 degrees. And it is related to the previous article and the problems of the sway, right? Because we have more contraction. And when we have more contraction, it means that we have less ability to choose different postures, to make faster movements. And what happens is that I can have more falls. But it's not just that. It's not just the posture or the postural control. We have problem with the visual behavior as well. So that's very interesting. In this image, you can see the A and B. A, it's what happens with low risk older adults. And in your right at the B, you can see the high risk older adults with high fear of falling. And what we can see, the biggest difference between them, it's as you can see, it's in this experiment. There are some obstacles, a series of stepping constraints on a level 8-meter walkway. And what happened? It's that for the people actually who has a high fear of falling, the fixation, the visual fixation was much closer to the place that much closer to her own body. So what happens is that you see in the low risk older adults, the visual behavior, visually I can see longer, I can see in a bigger distance. So it is much better also to deal and to predict any obstacle that will come into my way. So that's very important also when we are considering the fall risk. So poor visual behavior, it's related to more falls. And another thing, it's the freezing degrees of freedom from a motor learning perspective. So it's a little bit different. And it's interesting because when we are fearful or anxious, we have a regression toward stages of skill development by allocating attention toward the co-coordination of movement rather than the performance goal, compromising automatic movement control processes. So what's happening here is that because of my fear, I will some movements that would be automatic is not automatic anymore. So then I have to pay a lot of attention to normal movements such as walking, such as standing. And that's complicated too. That's not helping at all. Another thing that we have to discuss, because that's very important, it's the relationship between fear of falling and quality of life. So there's a robust association, and that's very interesting because if you don't address that, our patient will suffer. So it seems that in this robust association, when I have the bigger my fear of falling is, the lesser is the perceived quality of life. So that's very complicated, and we can imagine why. The patient cannot walk, cannot go to some places, is always worrying about his or her safety, right? So that's very complicated. Well, we talk a lot about the problems, so let's talk a little bit about the strategies and how to deal with the fear of falling. So we have to understand the fall risk factors, because even when we are worried with the fear of falling, it's just logic. If I have some real risk factor, I will be fearful. That's normal, right? So we have to minimize the fall risk, not just to solve the problem of falls, but also the fear of falling. So it's a strategy to solve both problems, okay? So we have the intrinsic risk factors and the extrinsic risk factors. So talking a little bit about the intrinsic risk factors now, we have a lot of medications that can give us these problems. For example, psychotropic, insulin, non-steroidal anti-inflammatory drugs, antiarrhythmic, diuretics, epileptics, and I put in red here because vitamin D works in a different way from the other medications. So the other medications, actually, if the patient is using them, it can be complicated. We have to talk with their physicians to maybe change the dose or change the medication. But vitamin D, usually it's not an excess. Usually we have a lack of vitamin D. And the lack of vitamin D can give problem of, can put you at risk of fall. So it's really important. Well, we have gait imbalance problems that can be a risk of fall as well. Lower extremity strength, and actually the lack of strength can be a fall risk factor as well. Osteoporosis, because we can have fracture. Vision problems, and not just vision. Sometimes the vision is okay, but the light score, so we have to pay attention to that. Cognition also is a problem for that. Dizziness and vertigo. Cardiovascular disease, orthostatic hypotension, hypertension, atrial fibrillation. Dementia, it's very complicated too, and depression. So we have to do our best to take care of all of this. Sometimes it's not our responsibility, but we have to talk to the people that it's taking care of the patient too, to make a teamwork. So to have this risk factors addressed as better as we can as a team. And we have the extrinsic risk factors as well. So I'm sure that these two angels that you can see in the picture, they are adorable. However, don't put an older person that has a problem of fall in the same place with them, because probably an accident will happen. You see, so we have to take care of this in the house of the patient. So we must to take out the traps for the patient at his home and at the clinic too, because the patient will walk sometimes. Obviously, it's easier for us to think about that, but just a reminder: our clinic must be thoughtful about the situation of the patient. So we have to solve all messes and actually help the patient to walk in our clinics, right? And the footwear is also important, because it has to be properly fit, so we will not have any kind of accidents as well. It's obvious and just a reminder. So the first thing that we have to do to prevent falls and prevent the fear of falling as well is to address and solve all these risk factors that we have been talking about all this time, right? So this is really important. Well, and this is very interesting too, because it's from Harvard, and it's easy home modifications that you can do to prevent falls. Just some insights for us. So you can use like some expensive fixes, remove fluid clutter and things like that, repair steps and flooring. So we remove the traps, right? Install grab bars, and that's very interesting for our clinics too. Use non-slip mats and treads. It's interesting for our clinics as well. We can install handrails. It's important. And improve lighting. So that's very interesting too, when we have some vision problems, and even without any vision problems, because when it's dark, it's easier to have some tripping that we don't want to happen, right? Okay, and then we go to the therapy. All of that we have been talking, it's a little bit therapy already, but now we're going to talk about physical therapy. And well, the therapy that we do, it's I don't need to teach the priest how to preach, right? Because you know what you have to do. But it's very interesting because in this systematic review also, it's from 2020, as you can see. People are saying, are studying this and are discovering again that lower limb and gait training combined with balance training, it's very effective for these people for training and practicing the gait and solving the problem of falls, which is amazing. We have been doing this for years, and we know that it's very effective. Okay, we know that it's effective again, which is really cool. However, exercise is effective in reducing falls, but its effect on reducing fear of falling is unclear. And that's what they discovered, that what they discussed in this other systematic review that you can see here. So it's unclear, but it doesn't mean that it's non-existent. I really believe that we by treating the when we reduce the falls logically, we reduce the fear of falling too. I don't know if it's in the same if the same amount that we reduce the falls, we reduce the fear of falling too. However, we probably have some reduction, but you have to be more attentive to that because because we have to address these as well. And how can we treat fear based on realistic threats? Well, we can do some other things. We can work with the safety of the patient, and that's very important because when the patient feels safer, it will be easier for the patient to cope with the fear. So that's very interesting. So therapies provided in 100% safe environment may be an extremely important step to treat the fear of falling component as a part of cognitive behavioral therapy. And it's very interesting. I will talk a little bit more about the cognitive behavioral therapy, but just to talk it in a very simplistic way about that. The cognitive behavioral therapy works in a sense of giving, for example, I'm fear of, I have I cannot explain the fear that I have about an animal. I don't know, spiders, for example. So what they do to solve that fear, they put me in contact with this animal in a very safe way, lightly, in little steps. So first, maybe just a picture of a spider, right? And then I can have the contact with a dead spider, maybe. Then a small one, but enclosed, but the normal spider that we see at homes. So then, little by little, I can get used to the contact and lose a little bit of this fear. So that's exactly what we are doing here. So little by little, we are getting this patient used to the threat of fall, but in a very safe way. So it's the same thing, you see? It's very important also to have community activities as well, if it's possible. So Tai Chi is amazing. It's a very well-known way that you can treat the patients, that you can reduce the fear of falling. Home-based exercises, home-based fall-related multifactorial interventions, all of them have shown to reduce fear of falling. So that's very interesting and something that we can use with our patients as well. Well, so here we have what we have been talking, and it's the fear-based in unrealistic threats. So this is a phobic reaction, exactly as I talk about the spider, for example, and we can have a phobic reaction to many different things, and one of them it's falling, right? So we have here a systematic review also saying that CBT interventions, the cognitive behavioral therapy interventions, have significant immediate effects and retention effects up to 12 months of reducing fear of falling. So that's very interesting. Sometimes we have to send this patient to a psychotherapist so to solve that problem, so we can work together as a team again. So for treating fear of falling, we have to treat all the risk factors involved in falls, plus beliefs related to fall, anxiety, neuroticism. So this also have to be treated. As we can treat it a little bit with the safe environment, as I talked before, and I give some examples, but sometimes we need more than that, and that's important. Many times we can solve that with treating all the risk factors, but sometimes we need more, right? And the bottom line of this presentation here, it's to invest in safety. So that's really important for your clinic. It's very important for your practice, for our practice. So safely expose the patient to challenges, because we need to challenge everything. We need to challenge the balance. We need to challenge the strength. We need to challenge the postural control. We need to challenge the strength, the strengthening ability of the patient as well. But all of that has to be in a safe environment. So the better thing that you can do for your patient, for yourself, and for your clinic as a clinic owner is to invest in safety. All right. So thank you very much. And I really enjoyed this time with you, and I hope you have an amazing time with the next speakers.